All righty. Good afternoon, everybody, and thank you so much for joining us for another one of our MAG specialist seminars. These things are going down a treat, and we're getting more and more requests and more people attending them. So we thank you all for that. Today, we are joined by the very lovely Dr. Stephen Vincent, who is a respiratory specialist. This is actually his third seminar with us. I urge you to go and catch his previous two on our YouTube channel, or you can access them through the menu bar in our MAG Cowercon booking platform under educational resources. His other two seminars are excellent. Today, he'll be talking to us about mould and respiratory disease, which is a very topical subject and something that's perhaps not as glamorous as the silicosis, but certainly just as prevalent and just as serious, and indeed probably an emerging area in many places in terms of occupational exposure. As usual, may I ask that you remain on mute throughout the seminar, but at the end of the session, there will be the opportunity for you to ask questions, or you can type your questions in the chat down the bottom and I'll make sure that they're read out and answered. So without further ado, Dr. Vincent, thank you so much for your time and your expertise today. I'll hand over to you. I will make you co-host so that you can share your amazing slides and we will get going.
All right. Well, thanks everyone for joining and the opportunity to talk about this subject. I mean, as you say, it's not as glamorous, but can cause a lot of harm, especially in the workplace, and also a lot of damage to properties as well. So that's not only some of the factors that we see is personal injury, plus a lot of damage to properties. But I think mould is one of those sort of unsung heroes that if it wasn't for it, pretty much our rainforest would just be full of leaves, decomposes everything. So it's sort of a nature's own recycling molecule and organisms. Now I'll start the slideshow. Okay, there we go. All right, so hopefully the title's up there. All right, so yeah.
Sorry, I just got to interject. Mould enthusiast. I'm happy now. That's made my day. Yes. Sorry, please continue.
No, that's all right. Well, I'll show you why, because if you have a look at the pictures, especially the ones on the right, I mean, they're quite beautiful under the microscope there. And so mould is probably one of the oldest living organisms on Earth. So it's what's called a eukaryocyte, where it's got more than one cell in its structure. And it can range from moss, fungi, the mould, of course, which I'll pretty much talk about the topic of the trial. So what you can see on the two right slides there is the furthest one on the right is the stem there that's called a hyphae, and then the actual head part of the mould is secreting a whole lot of spores. So this is how it reproduces, sort of asexually, creates these little balls of potential mould for the future, and these sort of just flap around in the air. We're breathing it in as we speak. We can't see them, but we've got a good innate immune system to sort of get rid of them. On the furthest one there, you can see a bit of bread that's just been left in a humid area that has got that nice colour there, which is actually mould breaking down the carbohydrates. I mean, obviously you don't eat that bread because it probably tastes fairly foul. So it's doing its natural recycling mechanism. It's found a piece of bread, some spores that have been blowing around the house have landed on it and start to proliferate. So you notice if you've ever had tomatoes in the fridge and you leave them in too long, they get this little fluffy look to them. That's the mould stem, and it all came from spores just blowing around. Now, it can cause problems with humans because we like to sort of create our own environment in the environment, including dwellings. And in the right sort of properties, you can get a lot of mould over production there, especially in situations where the humidity is above 65%, or there's poor ventilation, or there's any water damage. Now, the interesting thing about mould is that it doesn't require the sun for photosynthesis, so it doesn't require sunlight to grow. And as far as the nutrients it needs, it can actually get its nutrients from any surface in the house. So it can actually eat your carpet, eat the walls, and even burrow through concrete. And it also can break down paint and utilise paint as its nutrients there. So for us, what we want to do is avoid conditions that mould's going to proliferate, because one, destroys properties, and two, it can cause harm to humans, which I'll obviously go through. So what I'll talk today about, just the background of mould, what sort of problems it can cause with humans, which is quite varied. Some can be severe and life-threatening, and some can be more annoying. And then I'll go through a couple of cases that I've put through as personal injury cases that were predominantly work-related. Okay, so as I was saying before, single-cell organisms are things like amoebas that you hear about. They're the things under the microscope that float around. They've got one cell, whereas this is sort of layers of cell upon cell upon cell until they form this sort of intricate string-like layer there. So it doesn't really have any brain to it, no central processing unit. It just sort of goes along and grows and does its own thing, depending on which part of the mould we're dealing with. One is whether it's the hyphae, which is the string-like things, or the actual body of the mould where the little balls are. And pretty much, as I was saying before, it secretes enzymes into the environment, breaks them down, uses the nutrients, and just can grow. I think there's the largest living creature on Earth, apart from the Great Barrier Reef, is in the UK, where there's probably one piece of mould the size of 10 football fields that's all strung together. So these things just proliferate under the surface without us knowing. So in your garden, they also communicate plants together. So they know when a plant is sick. So it'll actually secrete special hormones and growth cytokines to sort of help with the plant. So they're good for plant communication. And as I was saying before, break down products for leaves and all that other stuff to give you that humus stuff, which you see in your compost bin. And it can occur in the dark. That's why mushrooms can grow in the dark without any problem, because they're a type of mould. And it's pretty much, the best sort of decomposing organic matter around. Now, in the house, these are the sort of typical species that would be found in a damp building. I won't go through the whole lot of name, but you can see that one's called penicillium, and that's where we get penicillin from. And the reason that that's works is that penicillin, the antibiotic, kills various bacteria. So if there's a bacteria that's trying to attack the mould, it secretes penicillin, and that'll kill that bacteria. And the things that you see on the surface in your house when it's dry mould, it's usually the black ones, because it's easy to see on white paint. So that's usually something called cladosporium, or down the bottom, aspergillus niger. So these are sort of the common ones that you see in wet mould. So all of them can cause harm to humans, which I'll go through. And it's not necessarily growing mould in your body, it's what they secrete. Now the little cartoon just shows the different parts of a typical mould. It's got the hyphae, which is sort of the branches, and then it's called the patella, which is the top bit. And those little conidia are the spores that get released into the atmosphere to grow more mould. And these things are tiny, we can't see them, and they just sort of are secreted off and just blow everywhere. And just sort of a background, the guy on the right is swinging a thing called an aspergillum, and that's where the name aspergillus comes from as far as the mould. That's just the shape of it there. So they look quite nice under the microscope and with drawing. So mould in the outdoor environment is good, breaks down products, good in the garden, and gets rid of all the waste products, but we don't want it in the indoor environment. If it's dry mould, it's not a problem, because everyone gets a bit of mould in their bathroom. Just spray a bit of exit mould on there and that gets rid of it. So when you see dark mould on pretty much dry or slightly moist surfaces, don't get too paranoid that you're going to get some terrible mold-related disease. It's more when you see that hyperproliferation that it's bad. And this is the sort of thing that can happen. So in a house that's been damaged with water, you might be a roof that's leaking without you knowing, it's going in between the walls. It could have been post-floods. Obviously, a lot of places get flooded these days with climate change, etc. The house may look fine, but if you've got a damp smell and you pull off the wallpaper or pull off the gyprock, this is the sort of thing that can be under the surface there, and that can actually cause harm to humans. And the trouble is, it usually takes about a year or two before anyone recognises that the mould caused a problem, because a lot of the patients just get fobbed off as being mad. If it's a work-related thing, the boss doesn't want to know about it. They try and just do a superficial clean of the place, which is not adequate. You need to really get the mould experts in if it's a problem, and sometimes it just means abandoning the building in some places, or doing a full rejuvenation. So mould in the indoor environment is not good. And the things that will result in proliferation is sustained high humidity. Now, what I think the building legislation says that dwellings should not be above 65% humid, but the trouble is, most places now with higher humidity, you're lucky to get below 75% even with air conditioners running. So you're going to get some sort of mould proliferation. In itself, if you've got good ventilation and no water damage, that's not a problem. But if there's poor ventilation and also poor drainage from around the dwelling, you might have water sort of seeping up into the building. And I'll show you what that all looks like. And you can see on the right-hand side, you've got a combination of that cladosporium, which is the dark stuff, and the aspergillus, and the white ones are the penicillium. So it's a whole lot of different moulds growing in that area. And it can pretty much utilise any material. It can eat the floor, get onto your couches, cause destruction of your couch, eat the carpet, and even eat wood. And yeah, amazingly, it can actually bore through concrete as well. Those little hyphae can secrete enzymes that breaks down calcium carbonate, which is the main molecule that's in concrete, and just goes through it. So it's pretty amazing stuff, really. Now, as far as the effect on humans, it's not only the mould itself. So there's no conditions where you can actually have mould growing like this in your body. It's more what it secretes. So if it secretes these spores, we normally breathe them in, so they can lodge in your nose or down your throat and into your lungs. But because we've got good defences, we usually sort of get rid of this, mainly with the mucosal lining of the nose, mouth and lungs. But if you've got predisposing factors, then you can get ill health from it. So the common things that we see with mould proliferation in the indoor is non-specific upper respiratory tract conditions, sore eyes, sore mouth, cough. Usually while you're in either the house or the workplace, which is affected, and just say it's at work, on the weekends those symptoms disappear, and when you go back to work you start getting a blocked, stuffy nose and sore eyes. And you may not know or see that there's a mould problem there. The mould can actually get into your sinus and start infection there. Don't worry, I'll go through these in a bit more detail. If you've got asthma, it can make asthma worse. In rare cases, you can get a specific condition called extrinsic allergic alveolitis, where you get a severe allergic reaction in your lung. And you might have heard things like farmer's lung or bird fancy's disease, where the proteins in the mould causes an allergic reaction in the lung. And there's sort of an emerging area called chronic inflammatory response syndrome. And this is from other products that are secreted from mould called volatile organic compounds. So these are small molecules that are secreted into the air, breathed in, and they can cause neurotoxicity in humans. And I'll go through one case where this poor lady was sort of left with brain fog, fatigue, sort of a chronic fatigue type syndrome, aches and pains. And due to the workplace exposure, she couldn't work for about 2 years because she, couldn't think properly, headaches all the time and so forth. And it took a while for anyone to recognise that, you know, this was a real thing and not her just trying to malinger. Okay, so as far as the upper respiratory tract symptoms, so the nose has got a good defence there. We've got turbinate, so when air goes through the nose, it usually spins around in these air ducts called turbinates. So any particle there spins around, and with centrifugal force, all the dust in the air, pollens, spores, etc., get shoved to the side and taken up by the mucosa, and then either swallowed, or when you blow your nose, that's what we're blowing out, all these products. But if the mould gets into the sinuses, it can actually cause a growth there, because there's not much drainage, and it can get mould growing into the sinus. I'll show you some pictures of CT scans in a sec. So these are the common symptoms that starts with anyone who's got a mould affected house, is just non-specific sore eyes, itchy eyes, dry cough, blocked nose and headache. And the trouble is, you know, during winter time, everyone's got these things. So it's very non-specific, and people don't really twig to it until they get the worsening symptoms. Now, as far as asthma, this is a condition where the airways through the lungs, so these are the pipes that supply air to what's called the alveolar sacs, they're the bits that exchange carbon dioxide and air, become narrowed due to mould. So you can see the picture on the left, it's what a normal airway looks like down in your lung. You've got, let's put the laser thing up. Yeah, so on the inner, so this is the airway. So air goes in and out through there, plus particles that are usually 10 micrometers or less. You've got these little hair-like structure called cilia, and what they do is they trap most small molecules and then sweep them up into the upper airway, and they're swallowed. But sometimes with mould or spores in people who've got predisposition to asthma, these things are damaged, and the mould can get into the inner layers of the airway. And then you can see on the right-hand side, this is what sort of a mould-affected lung can look like. You've got a narrowed airway, a lot of mucus hypersecretion, the muscles constrict, and you get breathless. So the classic situation is people who've mould asthma, go to work, there's some sort of mould issue there, and their asthma gets worse, and people usually don't twig at the start that it's due to the workplace. But they do find that when they're on holidays or on the weekends, that their asthma gets better, and as soon as they go back to work, it gets much worse on a Monday. And then you get a lot of mucus production as well, as the body's trying to get rid of the mould spores down there. Okay, and the sort of next step on here is something called ABPA, which is a condition where the lung actually gets destroyed from just mucus plugging from the mould proliferating in the lung. And once again, it's usually in someone who has asthma and a long-term low-level mould exposure. And the trouble is, once you've developed this, so this is a CT scan on the left-hand side. So where the laser pointer is, this is what normal lung looks like. So you've got the dark area, which is the lung tissue. These white lines are blood vessels. And you can see on the other side here, these great big cavities there. Those white things is just full of mucus and pus, and that's secondary to this ABPA. And this is the CT scan of someone who had wet mould damage in the Brisbane floods with the Department of Housing, which sort of ignored her and called her crazy for about 2 years. And then she unfortunately developed this irreversible lung condition. Okay, and just once again, that sort of highlights that on a CT scan on the left is normal. We've got normal lung tissue there. And on the right-hand side, there's these great big cavities, and this is mucus proliferation trying to use the natural defences to get rid of the significant mould exposure that this person is suffering. And it's not like they're sitting at work smelling that damp mould smell. This is, very subtle as well. It's mainly when the disease comes on that, people sort of think, oh yeah, it does smell a bit damp at work, and then the mould people find it. And just further on from this ABPA, this is a bronchoscopy, which is camera down into the lung. So the airways look nice and clean there, and you can see where that arrow is. There's a great big glob of mucus and mould spores there that's just blocking off airways. So these are the sort of conditions that you can get from mould exposure, which is long term. Okay, now what the sinuses are, we've got these hollow part on our facial bones. We're not sure what the exact reason for them are, but they're there. We've got two above the eyes, one they're called the frontal sinus. There's an axillary sinus just below the cheekbone, and these sort of curly things are the turbinates I was talking about, that when air goes in, it twists around these things to try and get rid of all the particles in the air. And the trouble is, if you get mould spores going into these sinuses, they can actually start growing there, and you can get sinuses which is full of aspergillus or cladosporin or the other ones. And this is a CT scan of the sinuses. So the one on the left-hand side is normal. So you've got axillary sinus. So when there's black, there's air. So that's normal on that side and that side. But you can see this is another workplace thing where they've got mould actually growing in the sinuses there. So these are just chock-a-block full of mucus and mould, and they can feel pretty rotten after a while. They pretty much need to have surgery to extract all that. So it's a good example of our airway going wrong, due to hyperproliferation of mould. Okay, and as I said, it can cause an allergic reaction where you get infiltrating cells in the lung tissue. It can lead to permanent damage. And the classic one's called farmer's lung, where the hay bale sort of left in a wet, warm condition, and all this is just mould here. And every time they start to work, they become breathless, and sometimes they have to leave the job being a farmer. There's people who breed pigeons that develop this. There used to be a condition up in far north, especially around the cane industry, where the refineries, what they do is when they crush up the cane, it brings out molasses, which is shipped off and turned to sugar, and the stuff that's left over is called bagasse, and that can become mouldy. And there used to be cases of people that had irreversible lung disease from the mould proliferation in bagasse. And believe it or not, you can get a mould-related disease called hot tub lung, where if people have got spas that have got poor sanitation, you're essentially just bathing in mouldy water, and as the bubbles go up, it just bubbles into your lungs. So that's the thing you got to worry about with spas. Okay, and what I was talking about before is this non-specific syndrome. It's sort of only recently been recognised secondary to these chemicals given off by mould spores called volatile organic compounds. We can't see them or smell them, they're tiny, but they give you non-specific things like headaches, lethargy, brain fog, and this can go on for about 2 or 3 years after you've finished with the exposure. Now, I'll go into a couple of cases just to sort of bring it to light. Okay, so this is case one. So unfortunately, looks like a lot of Australia is predisposed to getting floods. It's not just a Queensland thing. There's been a lot of floods around New South Wales, Lismore, a lot in Victoria. So once the floodwaters recede and all the rubbish is taken away, a lot of these dwellings are deemed unlivable and knocked down. But there was a whole lot of Department of Housing ones where they kept residents in them. And this particular lady that was in one of the Department of Housing ones in Brisbane, she was a 45-year-old non-smoking lady. She had a history of mild asthma. Her house was damaged during the flood, and for months she had this musty smell. She couldn't see anything at the start going wrong, just that sort of smell that you have when you haven't opened up a house for a while. It was there all the time. She rang the department numerous times. They'd come over and say there's nothing wrong. And then she was sort of labelled as being crazy. And then after a while, the carpets became damp. The cough worsened. She was becoming more breathless. She had to give up work because she was feeling so sick all the time, and she was in and out of hospital from this ABPA I was talking about. So this is the sort of things that she was getting towards sort of end stage, where mould was rising up from below. So this is all Aspergillus niger and that cladosporium. It's coming up in between the furniture there, and if you pull the carpet over, you've got this nice array of different mould there. So you can imagine living in that, that it's not good for your health, especially in people who are predisposed. And as far as the progress, they came over a couple of times, just did a bit of superficial cleaning. But after she'd gone back and forth from hospital, she paid for her own certified mould inspector, who actually deemed that the house was uninhabitable and had to be pulled down. So they relocated her to another place, but unfortunately she's permanently impaired from it. She's on long-term immunosuppressant medication to sort of help with this ABPA condition. And yeah, she's sort of a 45-year-old previously well woman who's now just a wreck from the mould in the house. Okay, now this is a bit more local. So Cairns Central Police Station, because it's so humid here that the air conditioning unit needed to have a thing called a dehumidifier. So the air that was going into the air conditioning had to be dehumidified first, because the air conditioner just couldn't cope with it all. And some smart bureaucrat down in Brisbane decided that the $2,000 a year to run the dehumidifier was a bit of a waste of money, so they got rid of it. No one up in Cairns knew, and after a while, people were complaining of black spores falling onto people's desks, people getting various symptoms of the respiratory tract infections, and eventually, when they came around with the mould inspectors, that's what it looked like on the inside of the air conditioning unit. That you could just sort of pull it off in layers there. So 10 police officers had to go off work for about 6 months, and 5 civilians, and they were on work cover due to this. And they obviously had to sort of pretty much go through the whole air conditioning system and replace it. And that was just due to high humidity in the police department, where the ventilation wasn't so great. Okay, and now this is another one where a lady, she was a sales rep, and she pretty much spent most of her working time in a car. She was in the car about 8 to 10 hours per day, 5 days a week. And there was some water damage, where there was a hole somewhere in the boot there that there was water sort of leaking into the back of the seats. This is sort of the picture of the back of the seat after about 6 months. So you can see that that's not normal. This is mould growing in from the boot. So she noticed from the start that it was a musty smell. She asked her boss if she could have a different car, but they said no. They took it to the car cleaner for a few times. There was just a superficial sort of clean-up job, but she said it still had ongoing problems, and eventually she couldn't get into the car because she suddenly started wheezing, coughing and short of breath, and then she unfortunately had to give up work. And then 2 years down the track, she still had the symptoms of the chronic inflammatory response syndrome, which was, labelled as being mad by a couple of the GPs, unfortunately. But luckily it sort of went through and she got compensation for it. But obviously, she was left 2 years not being able to work. And this is another lady. She was 55, otherwise well, working in Melbourne. And every time it rained, there was just holes in the roof there in some of the back rooms, and water would just pour through there. And once again, the owners of the building just sort of ignored everyone's complaints about it. So you can imagine all the water sort of pooled there. Carpet just had this musty smell and had mould proliferation there. It was sort of eating through the paint and also rising up through the carpet there. And she sat on the reception desk, and once again she had mould spores sort of falling onto her, especially during periods when it was raining and afterwards. And her asthma got worse, bosses weren't listening, and once again she just had to cease work because every time she went to work she couldn't breathe and her asthma got worse and she ended up in hospital. And she also went through work cover, and she didn't get much money because I think work cover down in Victoria weren't all that sort of up to date with mould, because it seems to be, as it's an emerging area, I don't think people sort of realise the seriousness of the condition. So I guess it's not everyone's going to be developing these conditions, but it's people who are predisposed, especially people with asthma or other respiratory tract problems. They're the sort of sitting ducks for a mould issue. So when you've got the right circumstances in the workplace or at home where you've got poor ventilation, high humidity, dampness, and usually in dark conditions, that's where the mould proliferates. Generally, you can't see it, you can smell it, and it's people who start to get sick is when it starts to sort of be taken notice of it. So I think we're probably going to see a great sort of resurgence of these mould-related things, and it doesn't automatically sort of twig to even a lot of GPs that that could be the problem there, but it can cause either minor irritations, which is the sore throat, runny nose, or it can lead to irreversible conditions with lung damage, where people can be permanently disabled afterwards. So I guess to summarise, so don't think mould as being an evil thing. In the right circumstances, it's good, we need it. But in dwellings, it's where the problems will happen. So if you go home and see the mould in your house, which is normal in the bathrooms, don't freak out. That's just it, doing its job. But if the right situation permits, and if you're predisposed, you can either have a irritating problem or something that's a bit more permanent. And it's quite expensive to try and rectify a dwelling that's been damaged by mould, because essentially all the damaged material has to be replaced and all the waters areas have to be sealed up. So I suppose that's mould in a nutshell. And I'm happy to take any questions if anyone has any.
Well, thank you so much, Dr. Vincent. That was as gross as I expected it would be. It's certainly very, very disturbing, and we've seen a number of cases come through us here at MAG of people who, as you say, have been treated as though they're complaining or difficult or mad. Perhaps they don't like the house that they've been put in, or they don't like their job, so they're claiming this madness that no one else can see, and indeed it has turned out to be a significant mould issue like that. One of the questions I had for you, and I noticed you said that there is a surgical procedure to extract mould from the nasal and facial cavities, but what about the mucus plugs and mould spores in the lungs that you showed us earlier on? How do they get cleared out?
Yeah, well, occasionally we have to go down with what's called a bronchoscope, which is like a little camera, and actually physically suck out all those blobs of mucus and mould. I mean, it's satisfying doing it. Satisfying.
As long as you've got a mask on and you're not inhaling any of it.
Yeah. But the trouble is when it's and the other treatment people need to be on is called prednisone or cortisone, which is it reduces the inflammatory effect of the mould in the lung, but it also is an immunosuppressant. So it predisposes people to other infections, from weight, causes depression, anxiety, osteoporosis. So sometimes the treatment for the ABPA condition can then lead on to other harmful factors as well. So that lady from the Department of Housing was on this prednisone for about 2 years and fractured a hip and all that sort of thing.
That's quite a harsh treatment, isn't it?
Yeah.
Now I have got one strange question, and it sounds like it almost sounds like it's come from my mother, but I'll assure you it hasn't. It's actually come from an insurer's case manager, and that is in relation to mould. And you mentioned the use of exit mould, a commercially available product. But there is some sort of, here I've got the note, okay, there's some discussion about what is the most effective to remove topical appearances of mould in a home or workplace. Is it true that the use of vinegar is just as effective as commercial products?
If it's very superficial mould and it's not in the grouting, if it's just on the tiles, the vinegar can work. But if you really want to get into it properly, because where the grouting is, you've got the surface mould that you can see, but it's also proliferating probably about 0.5 centimetre into the grouting, so you really need to kill it off with bleach. But then you can sort of run into problems in poorly ventilated areas where you can actually get terrible reactive airway dysfunction from using
exposure to bleach fumes.
Yeah, so you've got to be careful when using bleach and exit mold in confined spaces. It's got to have good ventilation for that.
Yeah. So look, it seems like for a lot of what you're saying is by the time that the mold exposure has been identified to the source, that in fact significant building works are required to remove, replace, and at the very worst or the very best clean. But
Yeah.
it looks like, you know, knockdown rebuild, it seems to be a very real option for a lot of this.
Yeah, I mean, some of the things can cost, up to hundreds of thousands of dollars to fix. And there's no other way around it, unfortunately.
Wow.
Yeah, so I think if it's a state government building, they'll pay for it. And we've had a few disputes with people who've had to move out of the flat that they just bought, and there was some sort of dodgy seal put on, and there was big fighting about who's going to pay for rectifying the building. And so it ends up not being personal injury, but also to do with fighting of who's paying.
Public liability, occupiers liability.
Yeah.
Yeah, wow. That again, absolutely fascinating. Has anybody got a question that they would like to ask of Dr. Vincent? Please unmute yourself, or you can type that down in the chat if you do.
I do, Dr. Vincent. It's Lou here. Is there basically an incubation period where someone needs to be exposed to mold for a certain period of time before it starts having some effect?
Good question. Yeah, it usually takes months. I suppose months for the sort of proliferation to occur. Probably a fairly short time for the non-specific sore eyes, runny nose, itchy mouth, that sort of thing. Those things are sort of, because they're common anyway with allergies and coughs and colds, you don't sort of think of it. But things like the sinus disease and the ABPA, which are the permanent ones, it could probably take up to 6 months to a year to develop those sort of conditions. So you need long sustained periods in the workplace before you start developing the sort of more irreversible or more severe disease. But the trouble is, once again, sinus disease is pretty non-specific. You don't know how bad it is until you do a CT scan. And same with that lung condition there. The main thing is breathlessness and cough. And if people just go back and forward to the GPs and antibiotics, sometimes it's not recognised until about a year or two after the onset. So it's an insidious onset condition that's can be put down to other things. And especially with that chronic inflammatory response syndrome, I think everyone that I've seen with that has gone through the system, seeing psychologists, psychiatrists, and being labelled as mad, crazy. And the trouble is, at workplace, if they start bringing it up, then they're sort of known as being agitators and disruptors and all that sort of thing. So they can be sort of put to the side and not listened to.
Wow. Well, Dr. Vincent, thank you again for a really insightful, very interesting and a little bit creepy seminar. We've got a thank you down there from some of our participants. It was really terrific. Now, everybody, the recording for this should come out to you this afternoon, but it might be tomorrow morning along with the slides. And of course, you can watch all of our seminars through the menu bar on your MAG CowerCon login, or going to our YouTube channel. And if you just Google search Medico-Legal Assessments Group YouTube, up they will come and you can see Dr. Vincent's previous seminars as well. We look forward to seeing many of you in our next seminar. And Dr. Vincent, again, a very special thank you for your time and your expertise today.
All right.
Have a great rest of the day, everybody.
No worries. Thank you.
Thank
Bye.
you.